Look, finding out you need an aortic valve replacement, well, that's a big deal, and it's totally normal to feel a bit overwhelmed. So what we're going to do here is try to make things a little clearer to help you really understand the choices you have. Okay, let's dive right in. So that's the big question, right? The one that probably brought you here. And the good news is you do have options. We're going to break it all down so you can feel way more prepared when you have those conversations with your doctors and your family. Okay, so when it comes down to it, you're really looking at three main options. Think of them as three different paths you can go down, and each one has its own pros and cons. So let's get to know them one by one. First up, we have the mechanical valve. And yeah, the name kind of gives it away. This is a highly engineered piece of equipment, usually made out of super strong materials like carbon. The main thing you need to know about this one, it's built to last. I mean, really last.
All right, option number 2 is the biological valve. Now, you might hear your doctor call it a tissue valve. This one isn't built in the lab. It's actually made from natural tissue, usually from a pig or a cow. So the key difference here is it's biological.
And then there's our third option, which is pretty different from the other two. It's called an autologous valve, and it's done through something known as the Ross procedure. Now, here's the wild part. The surgeon actually takes your own pulmonary valve and moves it into the aortic position. It's a bit more complex for sure, but it uses your body's own parts.
Let me take just a few seconds to say that, if you'd like to support my project, you can offer me a symbolic coffee on Ko-Fi. You'll find the link below in the description. You can also check out my book, where I've gathered many experiences and useful tips. Every gesture means a lot to me and truly helps me keep this channel and the whole project going. And if you haven't done it yet, I invite you to subscribe to the channel, turn on the notification bell, and visit my website or blog for more content. Thank you from the bottom of my heart.
Okay, so we've met the three contenders. Now for the main event. How do they actually stack up against each other? We're going to look at three really critical things: how long they last, if they require any special medication, and what age they're typically recommended for. Now this chart, this really lays it all out. Let's start with a mechanical valve on top. See that lifespan? 20 to 30 years. That's incredible. But, and this is the big but, you see that yes next to Coumadin? That means blood thinners for life. That's a major reason it's often for folks under 60. Now, slide down to the biological valve. See the trade-off? The lifespan is shorter, more like 8 to 15 years, but look, no Coumadin needed. That's a huge plus for a lot of people, especially if you're over 65 or 70. And finally, the Ross procedure. It kind of sits in the middle. 10 to 20 years, no Coumadin, and it's often an option for really young patients.
So at the end of the day, it really boils down to this one big trade-off. On one side, you've got maximum durability with the mechanical valve, something that could potentially last the rest of your life. And on the other side, you've got freedom from lifelong blood-thinning medication with the other two options.
Let's just pause on this number for a second. 20 to 30 years. Just think about that. If you're a younger person, that number could mean having one major heart surgery, and that's it. You're done. That is a really, really powerful idea. And here's the other side of that coin. That incredible durability comes with a catch. It's a lifelong commitment to anticoagulant medication like Coumadin, which means regular blood tests and being mindful of your diet and lifestyle. It's the central thing you have to weigh against that longevity. So after all that, you're probably trying to figure out, okay, so which one's the best? But the truth is, the right choice is, well, it's incredibly personal. So let's talk about how you and your doctors actually make that decision. And I really want this to sink in, because it's maybe the most important takeaway here. There is no single best valve that's right for everybody. It just doesn't exist. The only best valve is the one that is best for you, for your body, and for your life. The good news is, you're not making this choice alone. Not by a long shot. There's a whole heart team of experts that work with you, and they look at the whole picture. Yeah, your age and your risk level, of course, but they also look at your lifestyle, your other health conditions, and most importantly, your personal preferences. What really matters to you. That's part of the conversation.
You know, I want to end with this quote from the source material because I think it's just so powerful. The fact that you're here, watching this, seeking out information, that's a huge deal. You're taking an active role in your own health journey, and that, believe me, is an incredible foundation for healing.
So where do you go from here? You've got the info, you understand the basics of the trade-offs. The next step is talking to your care team. So I'll leave you with this to think about. Armed with all this new knowledge, what questions are you going to ask them to help figure out which path is the right one for you?